So welcome everybody at early this morning, and thank you so much for coming. So over the next little bit, I'm going to share with you some of my experiences. I'm going to preface this with saying that I am by no means the expert in the be-all and end-all in community-engaged research and partnerships and those kinds of things, but that really wanted to have an opportunity to kind of share what these kinds of things look like and how they play out, and what the implications are in the type of research that we do. And so just a little bit of the things that I'm hoping we can talk about is a little bit of the different types of relationships that people have, researchers have in the community. What are the core elements that make relationships work, and some of the strengths and challenges in working very closely in community research collaborations. And I'm really hoping to have some discussion because this is a topic that's near and dear to me, and I think it's something a lot of people work with and grapple with in those kinds of things. And so I'd love to hear from everybody. So I have lots of time set for some discussion and that sort of thing. And I should kind of preface this with, when I'm talking about this, I'm talking about my role as a researcher, primarily positioning myself in that kind of academic world, and as a nurse who does academic work in that kind of context. And so what I'm expressing is a lot about that perspective and coming from an academic perspective and a nursing perspective and what it means to work in community. And I'm not going to pretend to speak for the community organizations and community members that I work with, but I can share some of their insights and some of the things they asked me to share when we talked about me coming up to have a conversation about these kinds of things. So one of the big things that people think about, and I have to grapple with, is that there's many different types of relationships that we have when we work with community. And community can mean many, many different things to many different people. And so the types of relationships that I've worked the most with have been a collaborative type of relationship or a true partnership. And by true partnership, there's equal authority, autonomy, decision-making, fiscal management, those kinds of things. And so they can be very, very different, and those differences can be driven by a whole lot of things and different types of needs that people have. And so these are a couple of just examples of more collaborative kind of work. And so in collaborative kind of work, how it usually happens is that all research is about a problem. There's an issue or a problem or something that we're doing, and there are different ways that we engage around how to address that problem. But for many of us, particularly in nursing, working with people who either experience the problem or are engaged in addressing those problems are people that we regularly collaborate with in all the work that we do. And so these types of collaborations can take various forms. And in this context, in these kinds of papers that I'm just showing, this is a particular project that was really looking at trying to get a handle on Vancouver's off-street sex industry and what did it look like. And so it wasn't a true partnership in the sense there are too many people and too many players to figure out how that partnership could kind of navigate and those kinds of things. And so we worked with an advisory committee, a huge advisory committee made up a variety of how people describe themselves as experiential experts. So people who had who are currently or have previously worked in the sex industry in a variety of roles. They might now be working in community service organizations, people across all different spectrums of the off-street industry. And we brought together an advisory committee that helped to articulate sort of the core elements of the project. And one of the things that was really great in this kind of collaboration was thinking about how do we actually define the industry and how do we actually sample in that industry to get an appropriate sample. It's almost impossible to get a truly representative sample, but how do we actually strategize? So that's kind of a collaborative sort of approach. The other way of doing that kind of collaborative is starting to unpack what it means to be a community member working in this kind of work. And so in this other project, or this other paper, which is called Taint, it really was about working with people to understand the impacts and experiences they had and how stigma played out in their lives, be they were being in positions of advocacy and support workers for sex workers and or being sex workers themselves. And so helps with that, and in doing that kind of collaboration, is it frames the research in a particular way, because we don't want to contribute to perpetuating stigma, essentialism, and discrimination, and those kinds of things. And so those collaborations are very much about how to do ethical and appropriate research in a community that's highly stigmatized and highly discriminated against. So in that sense, it wasn't a partnership in the same kind of way of the other kinds of relationships that I've kind of had and think about. And also in this kind of thing, people engage with community members and community organizations to do a variety of things in research. Some people engage right at the outset, some people engage in knowledge translation. There's a whole lot of different ways that we do this. And in this particular example that's up, we have here the outcome from a meeting with 50 people who are experiential experts in a diversity of ways to actually look at the data. And what does the data look like? What is the data telling us? And actually looking at the analysis to generate a series of recommendations to improve health and safety. So again, there's different types of relationships and different types of collaborations that we have. And that, again, is just an example. And you can see there's a whole lot of different organizations that participated as well. WISH and Hustle, which is our for men engaged in sex work here in Vancouver, PACE Society, the BC Coalition of Experiential Communities, and most of you can see a lot of this, other than Hustle and the Health Initiative for Men, are all not-for-profit organizations as sort of community collaborators in this kind of context. So this study was very much about the community, grassroots, advocacy, activism, and service provision in terms of who was collaborating in that kind of thing. And for anybody who, I don't think, anybody who got to attend that event, it was a phenomenal event to bring that many people together. And in that process, we had 10 tables for discussion, and every table was facilitated by an experiential expert. And to actually nuance and explain the data, because we had people from different parts of health services and policy and law to kind of translate those findings into meaningful ways to be able to have those kinds of conversations. So there's that. And then, so that kind of way of thinking about collaboration in a diversity of ways is kind of one approach. And then what I'm going to spend sort of a little bit of time talking about is actually what we have now. It's just called our Outreach Project. And the Outreach Project is a true partnership in the sense of it's a community, academic, and community member kind of three-way partnership in terms of leadership and all those kinds of things that actually make the research possible. And the Outreach Project is situated here in Vancouver. It's within our downtown East Side community, and we're funded through SHIRC in their Partnership Development Grant funding, as well as the Vancouver Foundation in their Community Initiatives Fund, to be able to do something in the community and it's really designed at improving connections with women to be able to support their access and receipt of services within the community. So one of the big things about partnership and how we think about it is actually having partnership goals. So anytime we have a relationship with community organizations or community members, we have different goals, and setting those goals up front is really, really important. And for us, our goals, our entire goals of this team that we put together was to be able to collectively be more capable of responding to the issues with an equity-oriented approach to outreach, work in a way as a team to be able to support greater engagement of women who are affected by violence in civil society and at the government level, and study our own process and how we interact and work together so we can learn upon our interdisciplinary and multi-sectoral kind of collaborations and partnerships. And that the other piece we had in this goal, because we were funded through the Partnership Development Grant, is to be able to grow our team and to grow it on a national level, to be able to scale up the model that we're developing across Canada, and to see how it plays out in different contexts and how we can actually support the development of partnerships between research and community in a variety of different ways in different settings, particularly around the area of violence against women. So the project objectives, just to give it some context, again, we're about building these and sustaining these cross-sector academic and relationships with women affected by violence, all of our collaborations. The goal is to start to make connections with women who do not regularly attend to mainstream health and social services, and they don't attend for a variety of reasons: competing demands, discriminatory interactions, control by an intimate partner, and also they may not know what's available or may not be in a certain place of stability to be able to access. We also know that women get regularly banned from services. So this will make sense why I'm saying this when I talk about who all the partners are at the table and what we're trying to do. So they're labeled as behavioral misconduct when often they have significant mental health issues that are happening. So the other goal was not just to make connections, but to develop a sustained relationship with women over an 18 to 24 month period of time to be able to start to work with women to build greater stability and greater independence in navigating within the health and social service systems. And again, as I mentioned before, the core objective was to actually come up with a model that we could actually use and grow out. And again, that model wasn't just in how we connect with women, but how we actually, who needs to be at the table to actually launch this kind of project, to develop it, fund it, and launch it and sustain it. So it becomes really important in these kinds of things to think about the kinds of relationships that we build. And when I was thinking about this, I thought, what are the big questions that we need to answer? And it's, what are the most effective strategies for building relationships with people, organizations? How do we initiate them, sustain them, maintain them, those kinds of things? And how do decisions get made? Because these partnerships are never static. They're very dynamic. People move, people go, people need to bring other people in. How do you create a flexible model that allows for the integration of new people, that it doesn't become this silo, very protected silo, that other people can't come in and join the team because then it can't grow, kind of thing. So I have been very, very lucky in figuring out how to do some of this work, particularly with the organization, the Inner City Women's Initiative Society, which is located here in Vancouver and has been around since 91, 92, and is a not-for-profit that has been providing outreach and support services to women that are usually not included in most of the programming. So primarily women who have unstable housing, significant mental health issues, many have traumatic brain injuries, substance use issues, and they experience the most, in terms of thinking of longevity, severity, and duration of violence, they often have a much longer, severe duration of violence over the course of their lives than a lot of other women in society. So what happened is that Linda Dewar, who's the executive director, who I wish could have been here because I would love for her to share with you what this has looked like for her, went looking for a researcher and said, there's researchers doing this work. And so they connected with some researchers, but the women weren't eligible for that study because they couldn't attend to they couldn't attend to a fixed schedule. So this is a really problematic issue when we think about how we construct and create kind of interventions. And so then they connected with me and we went for coffee. And it's 3 years later, and I can't tell you how many more grant applications before we finally get funding. But the big part about the partnership is that the community identified the problem. It's not like I didn't know that violence against women is a problem or that service access. But the nature of the problem and the nature of the solutions really was driven by the community organization. And what's great about this community organization, and it's not simply a group of people who have made decisions for women, but it is very much informed and directed by women who actually are living the everyday life that the organization is trying to provide support for. So it has a very comprehensive kind of portfolio and board of directors and advisories and that kind of thing that help to identify. And for those of you who don't know, there was a phenomenal project done on violence against women in the downtown east side by a lot of the community organizations. They got some funding to do some small pilot work, and they They were just looking at the context of women's lives in the downtown east side. What do women need? All of those kinds of things. And addressing violence and connecting with women to address violence was one of the biggest priorities. Women's safety was the #1 concern. And so with all of that, we ended up going for coffee to have a conversation and to start thinking about who do we need to have? How do we want to do this? And so we started working. We started working together. We started figuring out who needs to be at the table, what kind of funding do we need to have, and who can help us to get those funds. And I can tell you our first grant application, even though everybody who's looked at it said it's one of the best grants they've ever read, was not successful with PHAC or FAC. And Live and Learn, we asked for too much money. We asked for too much upfront. Plus, we didn't quite fit their mold and how they wanted us to take up violence. So that was the other piece, was around thinking about how do we position ourselves and all those kinds of things. And so we put together a team with representative of women affected by violence, the community organization, and a variety of other organizations to kind of start thinking about what it is that we could do and how we might do it. And one of the big things it's been, as I said, a 3-year relationship. And one of the big things that we have really grappled with in a positive way, not that is how important it is to work with people's strengths. So one of the things that I always have to be reminded of is, my life is research. I have a research chair. 75% of my life is supposed to be dedicated to research. Community organizations and community members, it's not their priority. And so even though they want to be a part of it and they want to direct it and those kinds of things, we have to navigate and negotiate those relationships in the context of recognizing what their primary obligations are and what their primary commitments are, and that how we navigate and work with their time and support that is really, really important. The other thing is, I always think of this one, always remember, ask permission before you invite anybody to the team. We are really good at networking. As academics, we're really, really good, and we know people. However, if you have a partner, community organization, if you have relationships, everybody needs to be vetted through that leadership team. That was the initial that came together. And it's one of those things of flipping things on their heads. And most often no one will say no. But it is a process of having a conversation about, why would I invite this person? Who do you want to invite? And just not an automatic that somebody just gets to come in and be there. And always remember, and this is the biggest thing in terms of sorting out sort of our responsibilities, and this is our motto across all of the work that we do, the research needs can never usurp or come before or interfere with the needs of the community members that the project is designed to support and work with. And I put that in there because it's a really tricky concept, because so often we have obligations around our models, our rigor, or those kinds of things. And I take a very particular stance on don't care on a particular way, because at the end of the day, it cannot come across in a way that is harmful in the community that we're in. And one of the things that we've learned in the work that we've been doing in understanding people's experiences of research is that many people experience significant harm by being research participants, particularly people who have a lot of vulnerabilities. And so there's a whole problematic in that research relationship in community, and so this was an automatic, non-negotiable, absolute go-to. If you're going to work in this community, you have to be useful and you can't be harmful. And so we worked, in thinking those things through and trying to figure out how we put all these kinds of pieces together. This is what came out as really, really important. It is so important to have an effective leadership model. What is the actual model that's being implemented here? What is the process evaluation model? How do you know that this work is working? How do you know the team is working? How do you know that people are doing what they need to be doing? How do you know that these are the right instruments? Right across the board, how do you actually evaluate this leadership model in action, this partnership in action? And we often forget that piece in a lot of the work that we do. And then we can't figure out what's gone wrong, and people aren't talking to each other, and people are arguing, or Nobody knows what they're doing, and it's such a fundamental and important component. And you can write it right into the grant. This is the piece that people miss, but the evaluation of the collaboration is a fundamental, important component of what we do. And funders love to see it. That's the other piece, because it actually teaches the process. We're starting to evaluate and learn about what does this effective relationship kind of look like. And an effective communication strategy. This is so vitally important, and recognizing that everybody on the team will have different needs. So when Belinda and I have weekly meetings, I'm going to show you where our whole leadership team is and who's all involved, but we have a check-in every week. And so we've set that up, and that's sometimes, you know, it's negotiable. She's away, I'm away, people have life, those things kind of happen. But our general go-to is some sort of check-in once a week, and that's been our go-to. We set that at the outset, that we need to check in and see how things are going, and make decisions kind of together about how we bring stuff back to the team and those kinds of things. But it's also communication across everybody that's involved, and how not only that in terms of the team, but how you communicate the project, how you communicate the findings, and what you do with those findings. That all needs to be laid out up front, so that it's in a true partnership, so that everybody's on the same field, in the same sort of playing field of an understanding of what it is that we're going to do. There's nothing worse than a community organization finding out a pub has come out that represents all of the work that they've done, and they didn't know it was coming. And it happens. It's not because people are malintended, it just happens. There's different issues. So I'm hoping you can see this. This is our partnership team and partnership model for this outreach study. And you can see that we have a leadership team, and we have an academic leadership, service organization leadership, that is government and nonprofit, and a legal advocacy and policy leadership that we have sitting at the team. Now this is a big team. This is a big, complicated team. There's not all projects need to have this kind of team. But how we actually figured out this team is, what are the issues we're trying to address? What do we want to do with this information? How do we want to sustain it? How do we want to move it forward? And so we know, for example, that women's legal rights are often a huge issue for women who are very street involved. We know that not-for-profit does most of the work that the health system and the social service system does not do. They catch everybody who's falling through the cracks. Most often end up in not-for-profit. We also know that government, public sector, it's fundamental to have them at the table. If you want change, you have to have government funding. You have to have people at the table who can use that information and move it forward. Now, we're a national team, and I'll speak to that, why we are, and that's very intentional. And we have an academic leadership team from the School of Nursing here and the School of Social Work at the University of Windsor. And that is such a vitally important team. Nurses and social workers work a lot together and work really well together. And they're often an overlap in service provision, particularly for the women that we're working with. And so this is kind of our dynamic leadership team. Now, that being us, this is us who sits kind of at this is where the nuts and bolts get ironed out. But everything that we do, I'm sorry, I'm going to walk through here, is vetted through and discussed with our particular advisory groups. And we have a very specific advisory group for women affected by violence. And that group is intentionally separate from other groups. So that was a decision that was made within our women's advisory group. They're often not comfortable or want to be in a room with a lot of people from government or from other health and social services. They may not feel comfortable and they may not feel safe. Now, in other situations, that could be the case, and it would be okay to have this large advisory. But for women who have experienced a lot of discrimination, they want a very specific and unique advisory that is theirs. And this has been probably the greatest learning of my entire nursing career. I didn't get to meet the advisory for 3 months, which was fabulous, because Linda worked with women in community who put together an advisory. They worked together, they figured out their terms of reference, they figured out when I would get invited in as an academic. And they've been meeting every month since July, and everything that we do is discussed with them. We're in the middle of branding and logos, and all those kinds of things, our instruments, everything is discussed with them, and we take back whatever's happening at this leadership team, we take it back to them, and we go back and forth between. And the other piece is that our leadership team can participate in a 3-hour meeting or a 4-hour meeting. For many of the women on our advisory, that's not a possibility. And so it's being able to work within people's schedules and people's competing demands. So the women's advisory has to meet in the evening. Women have legal appointments, healthcare appointments, all those kinds of things. So we meet in the evening. Most academics don't meet in the evening. Plus, we're right across the country. If I try to meet with Nova Scotia in the evening, then everybody's in bed by the time that happens. So we've got these different kind of advisory groups, and we haven't fully developed our not-for-profit and our public sector human services advisory groups, because right now we're just connecting with them and doing some data collection and qualitative interviews around their roles and what they look like in the community and how they want to be involved. So you can see that this kind of decision making goes back and forth across all the ways. And this partnership took about, this is a year and a half in the making to develop these kinds of relationships and to sustain them. And the reason that we're national and across the board is that we want to be scalable. We want to tap into the expertise. So for example, the Nova Scotia Department of Community Services is way ahead of us in BC around thinking about the impact for women who have grown up in the foster care system. And how do we provide support and trauma and violence informed care for women as they exit out. Many of the women that we're working with have been in the foster care system at some point in their life or have children in care. And so being able to work and understand the complexities, a lot of the current thinking around trauma and violence informed care kind of overlooks that or glosses over that. It's a vital component of working with women. Plus they want to scale up. They want to be able to develop this, but they want to be specific to girls. So girls at risk sort of thing. And then our, as I said, our Intercity Women's and our legal advocacy group is West Coast Leaf, and they're just fabulous. They have a mandate around policy change and support and education and training for people to understand women's human rights and how to contribute and support women's human rights, and just having that kind of expertise is vital. And they have national connections as well for us to roll out. So I just wanted to give that as kind of, this is what a partnership looks like. And it doesn't have to be all that. Sometimes it's one organization and this kind of thing. But in order for us to meet our objectives, this is the kind of partnership. And we're already growing. We've got new partners that are coming on board. We've started to work with the neuroscience guys at UBC Okanagan and psychiatry here at UBC who are specializing in traumatic brain injury and intimate partner violence. And so this is what I mean, we're already growing, because one of the things that we're finding in meeting and talking with women in the community is that head injury is a huge issue for women, and it's not being taken up at all. So what happens to a woman when she goes into shelter, for example, she has a ton of paperwork she needs to do. She has a traumatic brain injury, that's the last thing she needs to do. But women aren't being assessed. So these guys are working really hard to help develop easy assessment tools so that shelter workers can identify and make appropriate connections, referrals. And if a woman needs, because you get a month in a shelter, usually after a brain injury, it takes a month for that brain injury to even start to calm down, if that, way longer. So those kinds of things are continuing to evolve and unfold. And so in all that, you know, this grant preparation, this forever chase of money that we do to kind of fund these kinds of programs, I put this up because these are some of the key elements in thinking about grant preparation. What are all the different types of funding sources, and who should hold the money? So there's certain funding opportunities that a not-for-profit is the better person to hold the money. And then if they have the accounting infrastructure to be able to do that. So having those kinds of conversations about what are the appropriate funding sources, who should hold the money, how should the money be managed, how does the grant get written? It's amazing to me how many organizations they live on grant applications. That's how they survive. and like donations and grants. And so being able to navigate and negotiate what is unique and special about their talent in grant versus when you're putting in for a research grant, who has those skills, and do people want to develop those skills, or do people want me to go away and do it and bring it back as a funded kind of package once we've hammered out the details. Budget transparency. If I could say the biggest complaint that we hear over and over again is that our partners have no idea where the money goes and how the money gets spent. They have no control over it, and they're not involved in it. And so that's not our deal. We make budgetary decisions together. We know exactly what our budget is. We finalize how that money gets spent in conversation with each other. We navigate and negotiate what is the payment for women who sit on an advisory. We have a conversation with them. We map with them aspects of what we can afford and not afford to do. All of that is a part of a conversation. I'm quite happy to hand over and have people look at all of the budget and how the money gets spent. And it goes a long way because researchers don't do that. Some do, not all do, but and again, this issue of deciding who will hold funds, and it's easier for me. I'm tenure. I have different needs and different things so if I don't hold the funds, it's not a big deal. But that being said, my career trajectory should never usurp whatever the needs are and what's the most success regardless. And so the other thing is that providing meaningful support so that people can be engaged as full partners, collaborators, and co-applicants, depending on their interests. So Marilee and Patricia can both attest to how important it is to provide CV support. It is so important to be able to provide that. These login systems are crazy. For anybody who's applied in SURE, people just trying to navigate and log in because I can't log in for them. So we do things like I will come and sit with a woman with my laptop and we will figure out how to get her an account and logged in so that she can be recognized and identified as a team member on the team at that national kind of level. And different people have different interests. So we know that we all need letters of support. Letters of support are actually quite detailed now. It's not just, I think this is a great idea. It's a very complicated kind of thing. So providing that kind of support, and it's hard. And the other piece is the sustainability and accountability. The question I get asked all the time, what's going to happen when you're done? Don't come into my community and do something if you can't sustain it. You're going to bring in this great intervention and then you're going to leave. And you'll be famous and you'll travel the world and we're going to go back to square one. And this happens all the time. And juggling that competing demand between what you can realistically accomplish, what you can realistically set out to do, is a constant negotiation in that partnership. And then some of the implementation pieces are, and I'm happy to talk more about that if people have questions, but is this kind of, as I said, the advisory committee and process, the ongoing team building, this core leadership needs to meet, and again, this process evaluation needs to be launched immediately. There needs to be a whole system in place, a good process evaluation framework, so that you have a sort of structured check-in, you have a structured way of knowing what your key points are along that, that's telling you whether or not this partnership is actually doing what it needs to be doing. And again, working to strengths and building capacity for all team members and participants is a really, really important point. So it's a lot about our kind of project, and it's something, so all of my work now has moved into a very partnership kind of model. It's moved beyond collaborative into partnerships in the work that I do, and it is incredibly time consuming and intense, but it's just so great because it's useful. It's a wonderful thing to know that it feels useful. It's not a interest, it's a passion and a commitment. So it feels useful, and it is useful because you're on the ground. The knowledge translation components of being in a partnership or a collaboration is phenomenal because you're working right in the moment where people can actually, by the time our pubs come out, they're only of interest to other academics. I know that's a terrible thing to say, but in many situations, and we need them, and they are important to advance the science. I'm not discounting, but our community reports, our interim reports, as these projects are unfolding, the things that we're learning, the mistakes that we're making, being able to deal with those in the moment is just such an incredible way to do knowledge translation. The capacity of the team just grows in leaps and bounds. And the accountability, I am always accountable. I have a check and balance that someone says, this is what we're doing. Our team is accountable. We're accountable to one another, and we're accountable to the women in the advisory, and they're accountable back. And it's just a phenomenal process to see how that plays out. And the commitment that we're seeing in this kind of partnership model, we are going to the hospital so to support one of our advisors to get a day pass so that she can come out to our evening meeting. Or we go to the hospital and we can have our advisory meeting there. We can book a room, we can sort it out. It just depends on whether or not the person who's not feeling that well and had to be hospitalized is able to participate. But that's her call, and then I just pick everybody up and we just show up, those kinds of things. And that's that accountability that we have to support each other in what we do. And what's really great about this project is we're very embedded with what's happening in real time in the current services and programs. So, for example, on the Downtown East Side, we're in the revision of services, the second version or whatever they're calling it. And so things that used to work are no longer there. There's a whole different series of programs. And so as we're engaged in this project and we're doing outreach to connect women with services, we're also learning what the impact of those changes are and how we have to navigate them to actually support women to be able to attend and receive those kinds of services. But it's complex, I'm not going to lie. There's lots of complexities. There's often competing interests and needs of diverse team members. Funding structures make it difficult sometimes for how we can pay people, what we can do. I'm going to go out on a limb and say the biggest barrier to good partnership is the university operations, fiscal operations, and reporting requirements, and those kinds of things. I'm always in trouble for creative workarounds in terms of how people can get paid, how people can be supported to do the kind of work that they do, how we transfer funds to an organization, how we hire students that are across the country so that they can learn and grow. I'm just going to say it, UBC is a nightmare for that kind of stuff, and it blocks so much of what we can actually achieve in our capacities to actually grow our graduate nursing students and in other disciplines, as well as to really effectively and fairly and honestly engage with communities in a financial kind of way. And the other thing is the experiential experts may have particular and unique needs that the team needs to pay attention to. One of the things, for example, that we know is that we do a lot of work with community health workers. And community health workers are women who have shared life experience. And so there's a lot of people are fabulous, fantastic. People may be in varying degrees of sobriety. I'm using their word. They may have significant trauma and violence in their past. And so all of those complexities play out in a relationship. And being able to navigate and support that you're not contributing to putting people in a position that is triggering or any of those kinds of things. And the amount of work that is required to maintain and support their effective engagement can be quite substantial depending on the project and who you're working with. It's all well worth it. You get it all back in spades. But for example, we were moving into a space that was donated to us, which is the Drinkers Lounge, which closes at 3, which is it reeks like a brewery. So we went to them and realized it's a huge trigger. People who've had alcohol issues don't want to be there. We're stuck now. Where are we going? Those kinds of things, and being able to respond in nuance. The other thing is around cash and how you navigate cash and people's support to be able to engage. And allowing people to exit and come back. So people, we all have lives. We all have things that happen in our lives. So people need to be able to exit and come back. And the advisory has been amazing about how they can support women who check out and need to check out and come back. So just a couple of exemplars that I wanted to end with. It's really interesting, and when I asked sort of some of the women who have seen some of this data, they asked me to share this because this partnership is the desired when people are working in communities, in that don't come into my community and expect of me, come in and work with me. And so these are a couple of quotes from researchers who participated in another project about this idea, you know, what kind of research do you do and what works? And so these are two particular, and I know I picked the negative, there's lots of great ones, but I picked these on purpose. So some of the challenges in that we face is, as this one researcher says, researchers have no business doing community-based research. It speaks to advocacy, and scientists are not advocates. It negates the scientific process. We need to be careful with community research. Those community organizations can take all of our money because they are so strapped. They don't always have enough resources for the services they provide. So it's really interesting because in the first example, as I probed along in this interview, the statement was, but communities need to step up and they need to give us access to their data and access to our people. So, and I'm hearing this more and more, people need to give us access to their data. They need to step up and be part of the solution. And so it's a really complicated thing when you navigate. This is the world for some researchers and not all, but the issue of money, whose money it is huge. And then some other parts from community service organizations, they talk about what works well. It works so much better when we're engaged right at the outset of a project, you know, develop a relationship, a plan together, what needs to be done, and sort out who's doing what. And then from a research participant who is part of had worked as a community health worker or peer outreach worker. So being part of a research study and being there from the outset, I learned a lot about how to do good research and how to be a real team member. My work on that project helped me to find my voice and be more of an advocate to support how research occurs in this community. So the benefits are actually significant for people. And so my last kind of key learning, I didn't realize I was going to talk this much, is that tokenism occurs. It's often non-intentional, but it is incredibly harmful. And this is the learning that I've had, and this is the learning that people have taught and asked me to share. Be prepared for the amount of time and effort to build and sustain a relationship. Be willing to let go of an expert. I have this great person who said, "You're in my world now." Be open to new ways of doing things. It'll just make everything that much richer. Fiscal transparency, it's the cornerstone of trust. Explain and share what ethics review entails. People don't know, it's not part of their everyday, and it is a long, complicated process, and why we need ethics and those kinds of things. There's a lot of co-learning around that needs to happen. When in doubt, avoid harm. Don't start something that you can't finish, and be prepared to address sustainability because it's huge, particularly when you do intervention work. Or when you hire people to be part of your team and then the money's gone. So how we figured those out. So thank you. And thanks to all the organizations who have joined. Thank you very much. We have 5 minutes.